Hey guys, Dr. Mitch here. One of the things that we commonly see patients for is low back pain. Now, there are a variety of contributing factors that might be causing low back pain, but often one of those is a lack of range of motion, both coming from the low back and the hips. So today I want to talk about a stretch or mobilization, essentially, that's going to help a lot of patients, and one that I assign very frequently to patients that helps translate to one, less pain in the low back, but two, a lot more strength and mobility in the real world.
So to understand what we're gonna do, I need you to understand part of why that so many people suffer with this. And as you can see, I'm sitting with egregiously horrible posture right now. And so a big part of the causative factor of this and what we're trying to undo is the drifting forward of the hips. That right now, my hips in relation to the rest of my torso are forward. Kind of same thing if I were to straighten up, lean back, that right now I'm pushing my hips forward in relation to my torso above it. So this is ultimately what we're trying to undo and target and fix. We also work with a lot of athletes, and one of the common things that I see is pain when people are deadlifting, or a lot of times people say things like, I woke up, I blew up my low back, I bent down to pick something up, my low back went out, and that if you aren't able to do a correct hip hinge, you are getting all of that rounding, as you kind of, I'm sure, saw there. I'm bending all through my low back. I'm not pushing my hips backward. I'm having to round here and then pick something up with load and try and bring that up. That is a recipe for disaster. So this is why we need to really work on fixing this. This isn't something that we're really reinventing the wheel with. It's just a hip hinge or a posterior translation of the pelvis in relation to the feet. So if you have something at home, I like this as training wheels. So if you have a pole, sometimes I'll use like a shower rod curtain, anything from like one of those pieces of furniture that's just a long metal pipe or PVC pipe, whatever. You can place that alongside your back. And so I like to go underhand grip and then overhand on top. The 3 points of contact we're looking for are 1, at the top of the sacrum or right at the top of the butt, 2, in between the shoulders or in between the shoulder blades, and then 3, the back of the head. And we should be able to maintain all those points of contact. If you aren't able to do so yet, that's something we need to work on, but that is the starting point that you want to try and maintain. From here, a good goal that I like to have people work up to is to go 2 feet length away from the wall. So stepping out with 2 feet, and then from here, while maintaining all those points of contact, you are going to try, without bending the knees, nice straight legs, just try and push those hips backward so that they touch the wall, and then you're going to come off. What you should feel is a really big, deep stretch in the back of your legs. What I want you to try and avoid, and why this pipe or this pole is here in the first place, is that as you go back, you lack the range of motion in the hips, so you round in your low back, which pushes that pipe or that pole off of the top of my butt right here because my low back is rounded. When you are able to get a good hip hinge, what will happen is that your hips can then drift all the way back, make contact, and then come off the wall. I like to think about almost like folding a book, that if you had it all the way open, you're just trying to make a V and close those pages. If you potentially can't get up to 2 foot lengths away right now, that's okay. That's why we work up to it. So you can start even just 1 foot length away. You can also modify as you need to try and get stronger and more range of motion. So another good way too, keep an eye on what your knees do as you do this move. I'll often see a lot of times patients will have one knee that can go back straight, one that will stay bent, and they'll sink very unevenly into this movement. And that is also something that we're gonna try and want to correct ultimately. So to recap, we're thinking pole placed alongside the back, right? Our 3 points of contact. Really think chest up to help maintain that upper back in contact. We're gonna go 2 feet length away. From here, we're gonna think about trying to push those hips back to the wall to just make contact. First one's always a little bit scary where you don't know where the wall is, and then just put yourself back up. As you get more advanced, you can get rid of the pole. That really, this is just training wheels for you to start working on that movement, that the same concept can still apply, that you can perform this movement without rounding the low back, keeping that chest up, and everything in line with the neutral spine. And now with your nice strong low back, you can deadlift anything, pick up anything off the ground, and make sure that you are staying pain-free, staying mobile, and continue to progress that. Keep up the good work, and good luck.